Morena, Simon, and joining us now as well is the Minister of Health, Andrew Little. Tēnā koe, Minister.
Tēnā koe.
Can you just start by giving us an update on today's case numbers and if Auckland's still on track to be moving out of level 4 on Tuesday?
I haven't seen today's case numbers. Obviously, yesterday's numbers were looking pretty encouraging, down to 11. Only 3 unlinked cases. I suspect they will have been resolved during the day yesterday. But so far, the numbers in the last few days are looking right, but we'll just have to see what the numbers for the next couple of days look like.
Do you know if there's anything going on in Tauranga? We're hearing that perhaps maybe one of those locations of interest that popped up yesterday could be spurring on further cases?
No, I haven't heard that. I know we had the case of the truck driver who travelled down that far from Auckland, but the advice is that he took all the right precautions, was masked, and so that is considered low risk. So not seeing anything problematic at this point.
I think a lot of people in Auckland are going to want to know about level 3 as well, because after last year's March and August lockdowns, we stayed in level 3 for at least 2 weeks. So should Auckland be preparing itself to have at least 2 weeks with, lockdown with takeaways? Yeah,
we've always seen level 3 as a reasonably short transition from level 4 to level 2. Again, it will all depend on what the numbers are looking like. And I think, as we're seeing with the Delta variant, it has changed the way things look compared to last year's version of COVID. So, look, we'll just take the numbers day by day as they are and make those judgments accordingly.
But it won't be any less than a fortnight in level 3 for Auckland?
Look, I don't want to get too far ahead of decisions that Cabinet makes. But as I say, we see level 3 as a shorter term transition period. But how long that is will depend on the flow of numbers over the days that follow.
And you're preparing our health system for next year's reopening, preparing it for Delta. Dr Bloomfield says that we need to vaccinate at least to 90% to be able to start reopening. Do you agree with that 90% figure?
I'd like to think we could get beyond that. I mean, we do need a high figure of a vaccinated population. We've seen other countries getting to the 80%, the Singapores, the Israels, and yet, the infection still happens and there's pressure on their health systems. The reality is about vaccination is it won't stop people getting infected, but it will minimise the impact on them, and therefore take more pressure off the health system. But we will still need to have measures in place. People still need to have a place to recover. I'm attracted to the Australian model, which is as many people as possible recovering at home in the community, but with regular monitoring from the local hospital. And then for people who do need more intensive care, hospital level care or intensive care, that we have places for them to go that are equipped to do that. And bearing in mind that within the outbreak, we don't know what the numbers are going to be. And if it's an outbreak outside of a metropolitan area, and a provincial hospital area, what do we need to make sure is in place so that the care is there?
As well as, so that home care model is really interesting for COVID cases. Could you do something similar as well for self-isolating? So people returning to New Zealand, and to take some of that pressure off MIQ, people would isolate at home if they're from low-risk countries, if they're double vaccinated, for example? Well,
we're in the process of putting together some pilots on just that at the moment, that the business sector pilot for self-isolating for people crossing the border. So we want to roll that out in the next few weeks. We'll have people actually crossing the border doing that self-isolating under that new sort of model. We'll see what that looks like and then see whether that can be expanded.
And you were also saying before we came to air as well that, purpose-built MIQs have to be, they have to be part of the equation, right?
Yeah, look, we will have to consider that. We're tying up a lot of hotel space at the moment. As we get the vaccination numbers up, as we start to reduce the restrictions, particularly on the border, and our tourism industry can get back into life, we've still got to have a place to go for people to isolate who are coming from the high-risk countries when they cross the border. So we are going to have to look at the facilities that we have available.
And to get to that 90% plus vaccination rate, would you mandate vaccines for all public servants, big business and healthcare workers, as we've seen the United States President do?
We are considering what we do with frontline health workers and whether we mandate there. That's under active consideration. And we'll see where we go beyond that, and we've done it with border workers and so on already. Where we go beyond that, do we have to look at food workers and others? Let's take some advice on that.
Public servants?
Not sure about public servants. I know that certainly the police, because and things like ambulance drivers, emergency services personnel, they are in the front line, the risk is higher for them. I mean, some of their organisations are saying we have to look very carefully about, who winds up in the front line. And whether they need to be vaccinated for it. I think a lot of employers are grappling with this issue. I think the government is going to have to play a role in working with employers to understand where we actually say the risk is too great, there's a bottom line here, and vaccination is it.
Because I wonder if you don't do it, if you don't mandate vaccines for the public servant, what would you say to the public servants who want to be able to go to work, to feel safe, to be around people who have been vaccinated so they've got less chance of contracting COVID-19? Could you at least force unvaccinated public servants to work from home, for example? Yeah,
look, I think this is a question we're all going to have to face, and I think there's also a question about the public service modelling, what we want the rest of the population to do. I'm not quite sure what the vaccination levels are amongst public servants at the moment, but look, these are all questions we are going to have to seriously consider. In the end, from the government's point of view, for a health perspective, we just need to maximise that number of the population that is vaccinated. The number of 90% is now used. I'd like to think we can get beyond that. As a country, we've done pretty well, actually, in our response to COVID. One of the best things we could do is lead the world in terms of vaccination rate.
So we've got that number now, thankfully, which took us a long time to get there, but we've got that number now, 90% plus. But how many people do you expect to be double vaxxed by the end of the year? What's the actual time frame like?
Well, we have said all those who can be and want to be, we want vaccinated by the end of the year. We're up to over 70% now have their first dose. We're doing roughly 60,000 a day. We've sort of settled down at the moment. There's still capacity to do more if we can. A lot of work going into getting into the hard-to-reach communities. We know that there are some pockets of the community where the hesitancy is more elevated, and we're sort of working on strategies to deal with that. We are just going to do everything we can to get the highest possible vaccination rate.
Come Christmas, what will the vaccination rate be in New Zealand according to the modelling that you've been looking at?
I can't say. We are working darn hard to make sure the rate is the highest it possibly can be.
But if it's not 90%, would you be prepared to lock down for Christmas?
Well, we're not planning anything for Christmas because we want to get...
If you had to, if there was an outbreak come Christmas and we're not at 90% yet, would the country lock down again?
Look, I can't say that. We make those judgments based on the circumstances as we see it at the time. We'll work hard on getting the vaccination rate up. There's capacity there. We want to get through the current lockdown, start getting people back to a level of normality, do the preparation for the system to deal with more relaxed rules, borders opening, and an acceptance that with COVID in the future, we are just going to have to manage infection outbreaks. And
with Delta, do we also need to prepare for some level of restrictions in perpetuity, so perhaps mask wearing or regional lockdowns for as far as the eye can see?
Well, certainly things like mask wearing, scanning, people should expect to continue, sanitising, those sorts of basic precautions. I think you'll see the health workforce will still have to use good PPE when they're dealing with in emergency departments and on the wards and what have you. So that'll be around for a while until we get to understand long term the way COVID behaves. Well, I'm not quite sure. I think there may well be some limitations for large and extensive out of control outbreaks. Again, we just don't know. But the idea of a level 4 lockdown, I think once we get through this, I'd be surprised if we ever see a level 4 lockdown again. Level 3 becomes problematic too.
That is going to come as a huge relief to the country.
Yeah, I think, but depending on the nature of outbreaks of the future, restrictions might have to be put in place. I think what's most important is we get our response correct from the health system so that we can minimise disruption to people.
And the rollout is going to get harder and harder as we go along. Those who want to get vaccinated have been vaccinated, and you're going to be pushing into those kind of anti-vaxxers or the vaccine hesitant. Will you set a deadline that says regardless of how many people have been vaccinated, we will start opening up to the world?
Again, look, when the numbers are getting up there, we'll start to make those judgments. I mean, there's a lot of thinking going on at the moment about what opening the borders looks like. We've started with the rating of the countries. Whether we continue with that sort of model, I'm not quite sure. We'll be opening up to the Pacific. We're letting the RSE workers in and go to and from. So there's stuff starting to happen now. Once we get through this outbreak and Australia sort of gets their things under control, we can look at opening up the border there. But we are just going to have to manage this kind of week by week, month by month, as we sort of gauge what is right for our health system, for our economy, and for people's sense of well-being.
We've had 27 deaths, COVID-19 deaths, but looking at it around the rest of the world, and as they're opening up, that number seems unrealistically low. What is the acceptable annual death rate for COVID?
Look, I couldn't put a number on that. We have death rates out of...
But we need to kind of try and hone in on, because this is going to be the reality. Denmark's got roughly the same population as us, but 80% vaccinated, starting to open up, but expecting around 1,000 deaths. Would that be acceptable to you? Look,
I can't put a number on it. We have death rates out of your basic sort of influenza sort of outbreaks from one year to the next.
So 500 a year seasonal deaths, seasonal flu deaths. So is that what we're...
I'm not going to put... No health minister is going to say this number of deaths is ever acceptable. What we do need to do is make sure we have a response that manages outbreaks as best as possible and minimises the risk of harm, including fatality, to people as a consequence of any future outbreak.
Taking that seasonal flu death rate, 500 a year, Maori are still nearly 4 times more likely to die of seasonal flu. Can you make a commitment? Can you ensure that Maori won't suffer the same disproportionate deaths from COVID-19?
Well, that's where we're trying to get to. There's even with this vaccination rollout, and it's in sort of fits and starts, but we're improving our equity performance. One of the reasons for the health reforms is exactly because the health outcomes for Māori and for Pacific have been so uneven that we want the Māori Health Authority to provide the kind of leadership that I know is there to improve health outcomes for Māori. We know with influenza, we have annual immunisation campaigns. The same will have to happen for COVID, I expect, and we just have to make sure that the systems are in place and the leadership is there so that actually everybody gets treated equally.
Could you also delay opening up? So we've got that 90% overarching vaccination rate, but could you also just refrain from opening up until you've got individualised targets for each ethnicity, age group and different demographics?
I think we want to make sure that the system, the health system, both in terms of the preventative measures, the vaccinations and what have you, but also the response, that there is an inequity based on ethnicity or race. And we've got a great system at the moment. We've got some amazing health providers, kaupapa Māori health providers, Pacific health providers, who are really forging ahead now and getting good responses, good systems in place for their communities. We will continue to support that.
Ashley Bloomfield's signalled that 5 to 11-year-olds will also be included in the vaccine rollout. When's that going to happen?
Look, there's a lot of work to go before we get there. Not many countries around the world are doing those under 12, but there is talk of that, talk of the need for that. We have to find a suitable vaccine that has to go through our Pharmac and MedSafe process. That is some way off yet.
We're also currently at 64% of the ICU capacity. That only leaves about 100 beds free. You've talked about some of those other home models, but is the workforce simply not there? And do you need to be putting more pressure on the Immigration Minister to bring in some of those doctors and nurses who are offshore and wanting to come to New Zealand?
So on that, we did, as a result of the outbreaks last year, started a program of work of training more nurses up to be able to work in ICU environments. So about 1,200 odd nurses, I think, have had that training. There'll be ongoing training and we'll continue that.
More than 1,000 offshore doctors and nurses who want to get
residency. And then
here.
in terms of folks coming in, healthcare workers coming across the border, I think nearly 45% of people who've crossed the border in the last 18 months have been healthcare workers. So we are letting a lot of people in, but we've got a lot of vacancies in the healthcare system, and so we need to fill those vacancies. Absolutely.
We've got only a minute to go, sorry, Minister, so we'll just ramp this up. Just quickly, I want to touch on medicinal cannabis. At the end of this month, many people using legal medicinal cannabis won't be able to access their medicine anymore. There's only one of the more expensive brands that's been approved. Are you going to relax standards for medicinal cannabis so that more products can be made available?
No, we're not. We've extended the exemption 3 times now, and we said the last time this is it.
Because the system wasn't working.
Well, the system is working. There are a number of applications under active consideration right now. There are a number of products that are available, but also people who are using cannabis-based products can, through the named patient system, continue to use products that haven't yet been approved. But we've got to know products that are available do meet an international safety standard. That's going to be absolutely critical.
Okay, and just on recreational cannabis, since 2019, police have been able to use discretion, take a health-based approach on arresting users. New figures show that while the overall arrest rates are down, they're actually up for Maori. So are the police showing their unconscious bias there?
Look, I've seen the reporting about that. I haven't sort of seen what underpins that. Often there's other associated activity. I'd be really disappointed if there is a sort of a racial bias coming through in those prosecution decisions. In the end, I think that is a matter that the police are going to have to continue to review and to have to look at.
Thank you very much for your time this morning, Minister Andrew Little. Kia ora.